If you have been treated for ovarian cancer, this tutorial will be immensely helpful. Remember, life doesn't stop after modern cancer treatment. Doctors and medical books say a lot, but what specific steps can help patients stay well after ovarian cancer treatment? Here are 5 clear pointers drawn from my own practice and experience in medicine. At the end, there is a brief look at what science says about maintenance therapy options with PARP inhibitors and Bevacizumab. Until now, everyone has worried about treatment itself. But in modern times, the question is, what happens after? How will life be once ovarian cancer treatment is over? The article addresses that. Ovarian cancer treatment is long and demanding, with many CT and PET-CT scans, surgery, and sometimes 6 cycles of chemotherapy. Many people get tired along the way. So here are some straightforward facts in simple language. First, prioritize follow-up care. Regular follow-up is very helpful and necessary for any cancer patient. It is not just about talking to your oncologist regularly to learn how to stay well. You also find out which symptoms you can ignore and which ones need your more attention. After treatment, some people experience tingling in their hands and feet and loss of appetite. Answers to those questions come from the regular follow-ups with your doctor. How does exactly follow-up work? How should ovarian cancer follow-ups be managed? How often is a CA-125 is needed? When are CT scans and PET-CT scans necessary? There are many opinions and ongoing research. Each patient's follow-up is different. Generally, follow-up continues for at least 5 years. Once early years pass, the chance of cancer returning decreases, so you do not need to visit the doctor too frequently. Pay attention to your symptoms. If you notice your tummy swelling or feeling full quickly or constipation, see your doctor. A few tests might reassure you, but such symptoms need attention. After ovarian cancer, it is also very important to have regular breast scanning or mammograms, typically once a year. Mammography is a type of screening test. If you want to understand screening tests better, we have a research article just on that. Reading it will make yourself clearly understand the benefits of screening tests. Remember, unusual symptoms do not always mean cancer is back, so do not worry unnecessarily. Tell your doctor honestly about how you feel. Do not hide any symptoms. Second, balance lifestyle choices. Pay attention to your diet and regular physical activity outside your home. What kind of diet is best? How to include more protein? What cookware to use? And who you should share with your evening meal with? We have 2 videos on this. Part 1, the unexpected diet, and Part 2, the unknown diet. Links are all below. Be mindful of what goes into your stomach. Try to chew all your foods properly. Make sure breakfast is substantial and filling. If you eat most of your protein at lunch, you will feel refreshed in the afternoon. But if you have protein in the late afternoon or evening, your tummy will feel heavy at the night, what we call gas or flatulence. If you don't like the diet chart or menu from your dietitian, tell them before leaving their office. No one wants to stick to tasteless food for a very long time. If you cannot consult a dietitian, ask your oncologist what food will keep you motivated and well in the long run. As well as protein, make sure to eat plenty of fruits and vegetables, fibers. Eating home-cooked meals should not be difficult. Occasionally, planning a cheat day with your doctor's approval. Days when you can enjoy some tasty home-cooked treats. Drinking enough water is very important throughout. Those whose ovarian cancer caused excessive fluid in the tummy may have water retention initially. Even if the treatment has reduced this fluid now, many fear drinking water or eating freely. That is not quite right. Take good care of your body. Try to walk outside for about an hour every day. If the area outside your home is rather dangerous, take someone with you and walk a little further away. But you must walk outside home. Also, aim for 3 to 4 hours a week of moderate to heavy exercise like yoga or aerobics. This will bring back your energy and improve your mood. Exercise will save you from unnecessary fear of cancer returning. Third, know yourself well. Many people mistake common symptoms like cold, fever, upset tummy, or treatment side effects as signs that the cancer has returned and become very worried. Avoid falling into those traps. Know well about what was ovarian cancer, what caused it, how are you treated. Also, are there any long-term side effects from your treatment? Read up about all these, at least as much as science know, so you can better understand your body's signals. Ask your doctor plenty of questions to fully stay in control of yourself. Learn to recognize yourself. Know what your mind needs. The first few months after treatment are a good time to get out and about or take a holiday. Check with your chemo doctor, and if the holiday spot isn't overcrowded, you can definitely go there. We have videos on how to keep your spirits up on holidays and how to shake off unnecessary tiredness after treatment to find more energy. Links are all below. 4. Live life free from fear. Pay close attention to your mind. Every cancer patient carries a constant fear. What if cancer has come? But living in fear all the time won't help. You must take care of yourself. Your mind needs attention too. Studies show chronic stress increases chance of cancer coming back. Dr. Michaela Ekblad seals that claim. Professor Ekblad and a team at Johns Hopkins University found the chemical reactions in the body where stress feeds cancer. To help you prevent this and learn how to keep stress away, we have a whole tutorial called Stress and Cancer. Do have a look. Stay connected to your friends and families. Talk to those you enjoy speaking with. Avoid those you don't want to engage with. Staying part of your close circle is very essential. In some culture, there is a harmful idea that the more you love, the more you will cry. No scientific research suspects this. So, open your heart, enjoy life, and learn how to live happily. If you feel really down, don't hesitate to seek professional help. Sometimes you may need to see a psychiatrist and possibly get counseling. There are many ways to keep your spirits up without medication, but if needed, taking a little medication won't hurt. Mostly, if you follow our tutorials, you will stay much better mentally and physically. Many of our patients say the same. Mind and body are not separate. To keep your body well, you must keep your mind well. 5th, on maintenance therapy. Now a few words about maintenance therapy. One day, your surgery or cancer chemotherapy will end, and then there is follow-up. Chemo is finished. That's called maintenance therapy. Now, maintenance therapy is well established for breast cancer, but for ovarian cancer, nothing quite as definitive has been found yet. Still, doctors try. The internationally accepted standard treatment for advanced or aggressive ovarian cancer is surgery, followed by 6 cycles of chemotherapy, usually with platinum and taxane drugs. In some cases, the bevacizumab is added to certain cycles. Maintenance therapy means giving long-term medications after initial treatment is over, so patients can stay well, disease-free for longer. As mentioned, the role of maintenance therapy is well recognized for breast cancer, but for ovarian cancer, it remains highly debated. Plus, these drugs are very expensive, putting them out of reach for many. If that sounds discouraging, do not despair. As of now, maintenance therapies have not been shown to significantly extend overall length of survival for ovarian cancer patients. Research continues and opinions vary amongst experts. I am not a medical oncologist, so please do consult your medical oncologist for further chemo advices. Still, here are some key points from recent research, though the situation is rather complex. The medicine that delays cancer progression or improves progression-free survival, or PFS, does not necessarily improve overall survival, or OS. Science has yet to fully understand why ovarian cancer defies even common sense. First, bevacizumab maintenance therapy. The AGO OVAR 17 study showed that bevacizumab does not currently improve overall survival. The prestigious GOG 0218 trial found that adding bevacizumab after 6 chemo cycles extends progression-free survival by about 3.8 months, from 10.3 to 14.1 months. Is that adequate for you or not? That's a personal choice. Therefore, Whether to take this drug or not should be a personal decision in consultation with your oncologist. PARP inhibitor maintenance therapy. These new and expensive medicines are researched extensively. We have seen Solo 1, Prima, Paula 1 research trials with more results expected. Prices have dropped, but these remain costly. Many ask if PARP inhibitors really extend lives. To check your suitability, doctors will test your genes for mutations. For patients with BRCA mutation or HRD positive tumors, PARP inhibitors clearly delay progression and improve progression-free survival. But do they increase overall survival? They may add a few months, though not enough for scientists to call it significant. For those without these special mutations, results with these drugs are much less promising. If cancer returns, there are multiple chemotherapy options. Science is progressing daily, so always discuss decisively with your medical oncologist. Genetic testing provides more than drug guidance. It also informs whether you or family members might be at risk of breast, ovarian, colon, lung, or prostate cancer. Knowing aids winning the battle. A detailed article on this is coming soon. Follow us to stay informed. If you have more questions, ask in the comments and I will be happy to answer all of them. That's all today. See you soon with another research article.